cancer is really only 10% genetic, 90% is environmental. And that's extremely important to remember because, these oncogenes or these cancer genes that we have are variably expressed. So it's not like if you have one of these oncogenes, they will be expressed and you will get cancer. It just doesn't equal, one doesn't equal the other. If you have them and the right environmental conditions are created around that, you will express that gene, and that's when cancer develops. Hello, everyone, and welcome to Peak Health with Dr. Gupta. This show is for those who want to optimize their health, maximize their genetic potential, and have some fun along the way. All of us have had a friend or loved one affected by cancer. In fact, approximately 40% of individuals in the US will be diagnosed with cancer at some point in their lives. That is a huge number. Conventional medicine focuses a lot on screening methods for prevention, such as surgery, chemo, radiation, other types of things for treatment. But what is not discussed enough is that you have the power to make change, and a lot of control is in your hands in terms of prevention and treatment. Many people feel hopeless, but this certainly should not be the case. And today's topic is part 2 of our series in feeling empowered regarding cancer treatment and prevention. In that light, I'm excited to welcome today Dr. Diva Nagula, who is a physician who was diagnosed with stage 4 non-Hodgkin's lymphoma in 2014. By integrating a holistic and functional approach to his traditional treatment regimen, he beat the disease into remission and kept it there. In fact, he wrote a new book called From Doctor to Patient, Healing Cancer Through Mind, Body, and Spirit. And it takes readers inside his remarkable journey through heartfelt narrative passages that highlight the importance of balancing the mind, body, and spirit for optimal health. Dr. Diva Nagula is a board-certified osteopathic physician and has extensive knowledge and training in integrative and functional medicine. Dr. Nagula grew up in Alexandria, Virginia, and his interest in medicine developed at an early age when he decided to follow his father's footsteps. Diva graduated from Lake Erie College of Osteopathic Medicine and completed his residency in physical medicine and rehabilitation at EVMS and a fellowship in interventional pain at Emory University. He opened a practice in rural South Georgia, as well as a surgical center in Georgia, where he performed cutting-edge interventional procedures. Recently, Dr. Nagula trained in integrative medicine under Dr. Andrew Weil, and he's relocated to DC to be closer to his family and friends. He is committed to his passion for healthy lifestyles, and he believes most diseases that plague this country can be prevented and sometimes treated by positive health and lifestyle changes. Welcome, Diva.
Hey, thanks, Ravi. Appreciate you having me on your show today.
Absolutely. Happy to have you. So let's get into it. Can you just tell us about how your story began?
Yeah, so in about 2000, at the end of 2012, I exited my practice. And so I was just going to take some time off before I decided to take on the next project or next adventure. And around that time, I had gotten married and I was just living a really grand life in 2013. And towards the end of the year, I had actually noticed that there was some cysts around both sides of my neck. Nothing was painful. I was feeling great. And I thought it was just some sort of dermatological issue. So I went to the primary care doctor and he took a look and he says, yeah, I don't think that those were cysts. Those appear to be just lymph nodes that are enlarged. So let's go get a CAT scan of your head and neck and just see what's going on. And then, after that, we'll also get some blood work and we'll see what's happening and then go from there. So I got some blood work done. Blood work looked pretty good. I got the CT scan of the head and neck, and my lymph nodes were extremely enlarged. It just lit up like a Christmas tree. It was, and they even got slices of my axilla, and they showed that there were some enlarged lymph nodes there. So at that point, it was like, what's the diagnosis? What's happening? What's the etiology of this? And so he thought it was best for me to go see an oncologist just to get the workup done. Nothing at that time showed that there was any definitive diagnosis. So I went to the oncologist, had a whole battery of tests, lymph node biopsy, more imaging studies, and February 12th of 2014 is when I got the diagnosis of stage 4 non-Hodgkin's lymphoma.
Well, that must have been quite an ordeal to go through, and I appreciate you sharing that story with us. Is there any history of cancer in your family? Do you have any idea of how you developed this diagnosis from like maybe a exposure, environmental perspective?
Yeah, I mean, looking back on it, there's a lot of theories. I don't have any cancer history in my family, so and non-Hodgkin's lymphoma is not something that's genetically predisposed, so it wasn't genetics. So for me, it was trying to figure out what was the etiology, more so from from a scientific curiosity perspective, but as well as understanding why, so that I wouldn't be privy to those types of circumstances and influences in my health again. So I feel it's a combination of issues that really caused me to have the cancer. Um, for me, at that point, it was about what I knew in my mind. It was, let's figure out from a physiological perspective. Let's figure out from a mind perspective, because those things are very controllable. So I looked at my own physiological health, and it was evident that I was not eating very well. I was eating very poorly. I wasn't eating a full balanced meal. Everything was fast food, fast casual. And you would think I would know better as a physician, but unfortunately, in medical school, they don't teach you anything about nutrition and the importance of health, or importance of diet. And so I would choose to eat, something from Subway versus McDonald's, because I thought Subway would have a little bit more nutrition because it was offering more of vegetables and tomatoes and lettuce and your choice, instead of having a burger at McDonald's. So that was my belief in eating healthy. And unfortunately, it was years of this type of behavior, and that's the thing about cancer. It's the circumstances that lead to cancer isn't something that happens overnight. It is a cumulative of years and years and years of damage and issues that accumulate over time. And so for me, it was after I left high school, I was on my own, and so it was years of just putting my body through crap, eating really badly. And that's only one facet of the problem. There's other facets of the issue too. It was about, you know, getting a regular set of exercise and maintaining an optimal regimen in exercise, as well as nutrition. And for me, nutrition, I had to relearn what nutrition was, and it was not just about eating a balanced type of meal. It was more about eating something that was more organic. I had to understand what that meant. Eating things that were non-GMO, eating things that were less toxic to my system, and that was really important. But I feel that that was one aspect of it. There was a whole another aspect of it that was really more along the lines of psychological and mental health. I was, as an entrepreneur, and many entrepreneurs can probably relate, because we're so driven and we're so hard on ourselves. And for me, I was in a practice for almost 10 years, where I was just driving and grinding. So wasn't sleeping very well. I wasn't taking care of myself, didn't have community, and really just didn't have any outlets. And so this was not only a decade of my life when I was in practice, but this was how we all are as physicians. We go through this rigorous process of doing really well in college, then we have to grind and do really well in med school, then we have the residency, and then those are years and years, as you can relate to, of training, where we're not sleeping and we're just working really hard hours. And so then I can dial it back to childhood, and it was like it was the parental influence of just grind and study. And there wasn't any kind of outlets that I was exposed to. It was just all very, very narrow-minded, one lens type of perspective of just do well in school. And so my parents were extremely hard on me, and as most people who are descendants of people who have immigrated from to this country can relate. And so I think it was just a combination of all these factors that really led to, it was basically, it was just I was ready to pop. And that essentially, in my mind, contributed to the non-Hodgkin's lymphoma diagnosis.
You know, as a result of all of what you discussed, and we'll discuss more of that in detail, you're in remission and you're healthy, and I love that, and I really celebrate that. But all the things that you mentioned sort of are additive qualities to manifest this disease process. And doesn't have to be necessarily cancer that's manifest in people, but other types of disease processes are manifested in people because of these types of lifestyle choices, because of lack of exercise, diet, proper diet, nutrition, good psychological mental health, that type of thing, having good sleep at night. And something to keep in mind for the listeners is that cancer is really only 10% genetic, 90% is environmental. And that's extremely important to remember because, these oncogenes or these cancer genes that we have are variably expressed. So it's not like if you have one of these oncogenes, they will be expressed and you will get cancer. It just doesn't equal, one doesn't equal the other. If you have them and the right environmental conditions are created around that, you will express that gene, and that's when cancer develops. So really the focus, and what you've alluded to, is the focus is correcting all those behaviors. And once you correct those behaviors and you basically focus on your health, you are changing your physiologic environment such that those genes or those negative influences aren't there, and it creates healing, and that's when you can obtain that type of health. So can you let us know what happened after that diagnosis? Now that you explained sort of how that occurred in you, your thought process of that occurring, and you're diagnosed, what happened after that?
Yeah. So I had gone to 3 different physicians. The physician that I first saw that gave me the diagnosis was a private practitioner, and he told me that I needed to go through a very, very harsh course, a very aggressive course of chemotherapy. And this was like, if you're familiar with it, it's the R-CHOP regimen, which is very, very potent, strong cancer treatment. I had a hard time believing that this was my only option because I was feeling really good at that time, and not to mention I wanted a second opinion. So I went to Sloan Kettering, where they told me that I was probably it was not in my best interest to have that type of aggressive chemo because I was so young. I was 40 years old at the time, and he considered something else that was a little less aggressive. But he said that because I was feeling well and I wasn't exactly showing any overt signs other than lymph nodes being enlarged, that he thought a watching and wait would be something that I would probably benefit from. And the watching and wait is basically just doing nothing and just seeing if it would regress on its own. And so during that time frame, I chose to opt for the watch and wait. I sought another opinion at Mayo Clinic in Jacksonville, and he said the same thing too. And it kind of dawned on me, I'm like, why are these university physicians saying watching and waiting is something that I should pursue versus going to this private practitioner who said, let's do the most aggressive therapy. And then it dawned on me that, this guy, they had their own infusion center. And so it was definitely, it was more what was in for him, rather than what was in the best interest of the patient. And that kind of really disgusted me because that is the plight of a lot of patients who don't know any better. And it's unfortunate because they have a trust in physicians. That's a whole different story and a topic, which I won't go there, but I'm glad I got second opinions. And this is me as a physician that went this route, and so, the lesson here is just keeps getting opinions, and do your own education and really take control of this, and be more empowered and not disempowered. But I digress. And for me, it was the watching and waiting. And so I studied, I read.
If I can just add to that digression there. I mean, that's a very important point. And people don't necessarily realize that because when they see a physician, they think that, hey, look, this person has my best interest at heart. I will listen to anything they tell me. I think, it is important to trust someone and believe in someone, but also do your own research. Trust but verify, right? That's why we have podcasts like this. So there's many others out there. It's important to understand what the treatment regimen is and what the side effects are. and if it's right for you. And it's important to get a second opinion. I mean, as a physician, been in practice for many years. I have certainly seen different clinicians practice in different ways, and they're justified. Some may say, "Hey, look, I'm conservative. I'm going to do this approach," and the others may say, I do want to hold back and not do this." And there's evidence pointing in both directions. It may make sense in both directions. You can justify it either way, but that's where the art of medicine comes in, and that's where personal choice comes in, and self empowerment comes in, where you make the decision, you help formulate that decision. So that's what we're here for, to educate all the listeners out there to these possibilities. But I appreciate you bringing that up. That's actually a really important point.
I respect that as well. It's important to stay empowered, and not only in your own health, but in life in general. That's just a fundamental fact that I like to follow for myself.
Yeah.
So what I had done was I had done a lot of research and reading at that point, studying and just figuring out what I needed to do to optimize my health. So I had switched my entire diet. I threw everything in my closet out the window, out the trash. I had started to eat everything that was gluten free. I didn't eat any more. I refrained from carbohydrates because I learned that when a person is diagnosed with cancer, carbohydrates and sugar fuel the cancer, and this is not something that's taught. And so I eliminated all forms of sugar, and I basically was just eating any vegetables and protein that were organic and grass fed. That was extremely important. The transition to that diet was extremely difficult because my body and my microbiome was craving just this fast food, fast casual, because that's what I eaten for so many years. So for me to be able to switch was very difficult. But after about 3 to 4 weeks, I had shifted my microbiome, and it started to accept this new diet, and it started to crave the fruits, the vegetables. And of course, the fruits that I was eating was very low glycemic, and same with the vegetables. And then I wasn't working at the time, so I didn't have the stress of going into work and endure all that. It was just really being able to take care of myself. I had I had a second home in Asheville, North Carolina, in the mountains. So we decided to live up there for during the from the spring season to the early fall. And it was nice to being in the mountain air, did a lot of hiking, just was able to just get in one with Mother Nature and just really be able to take care of myself. And then it was October when it was time to go back to Florida when I started having this back pain. And the back pain was pretty intense and is radiating into my groin. And as a healthcare practitioner, everyone knows that's a sign of either urinary infection or you have kidney stones. And because I had cancer, the likelihood was high that it was kidney stones just because of the high cell turnover and the buildup of uric acid. So that's what I thought it was. My oncologist said, let's go ahead and get your scans done early because I was scheduled for my regular scans at that time. And the scan showed that my cancer had grown aggressively. What previously was, 1 centimeter size lymph nodes. Typically, these lymph nodes are like in millimeters. And so they were enlarged to begin with, which we know that, but they had grown to like these masses. So they grew so much that you couldn't even tell the individual lymph nodes from one another because they were all grown so much. And they coalesced into this mass all over my body. And he said we needed to start chemo yesterday. So that's when I started the chemotherapy. And at that time, it was just a beginning of a whole new therapies. And then for me, it was a whole new discovery of issues that I had no idea that was bothering me for so long. It was the loss of control that really crushed me because I'd always been an individual that was always in control of my destiny and everything. And for me, that I had to surrender and yield to therapies that was beyond my control was a huge, huge issue for me that I didn't even understand. Looking back on it, I understand now, but at the time, I didn't know what was happening. And so at that point, I went to a deep depression because I had lost all hope, and I had been a very successful person up to that point where everything that I set my mind to do, I was able to accomplish it. And this was the first time in my entire life where I put in 100% of effort and I didn't get anything out of it. So it's a big lesson that I had learned at an early time in my life, and I'm glad that I did learn that lesson. It wasn't until years later where I started to understand what that was all about from a spiritual and a mental mindset and framework.
Yeah. Well, wow, that's yeah, I can imagine the intensity of that situation. So it sounded like after you got the diagnosis, when you were in the watch and wait period, you started taking some steps and in the functional medicine realm. And there's basically five basic, tenets of functional medicine or root causes of disease, and it's sleep, diet, exercise, stress, and toxic exposures. So, did you take all those steps? Did you try to eliminate all those things from your?
Yeah, I mean, and that was a huge part of it was eliminating toxicities, right? So one of the things that I learned at the time, an environmental toxin known as glyphosate, which is prevalent in our foods and in our environment, is a huge, huge correlation with non-Hodgkin's lymphoma. And in fact, right now there are these huge lawsuits that are against Monsanto Bayer that are by defendants who have been exposed to to glyphosate for a long period of time, and these are the people that have non-Hodgkin's lymphoma. And so I used to be a golfer, and I was playing a lot of golf, on the weekends, things like that. And so was this contributory? Sure, but then what about all the foods that I was eating that was GMO, and all those GMO foods? Even wheat in itself is ridden with glyphosate, and so it was a big shock to my system understanding how much of our society was plagued with these types of toxins. I mean, everywhere you look. And then you realize that, you know, um, things that we use, personal care products. I mean, there's over, for a female, there's over 110 products or chemicals that's on their body that they put on before they leave the home to go to work every morning. For men, it was like 85, known toxins that you're wearing, and this goes from shampoo to deodorant to soap, to shaving cream. I mean, all of it. So it was eliminating all of that, and so I was like, if I had a fighting chance, and I had to do that, and so I went really deep in understanding, what I was exposed to. And that's why I chose to go into the environment of the mountains versus the city, because you're less likely to have these types of exposures. And it's everywhere, but at that point, it was about minimizing it. And then
Yeah.
also a big thing for me was how do I optimize my current my supplement regimen? And one of the biggest things for me was vitamin D. And so being outside as often as I could, it was the best way to optimize vitamin D levels. And my vitamin D was extremely low, and I was living in Florida, and I was working in Florida, where sunlight is 330 days of the year, and so my vitamin D levels was below the low range. It was 19 nanograms per deciliter, and the therapeutic is between 20 and 100, or 20 and 80, depending on where you're looking. So, and I knew immediately that vitamin D is important because it has 10 it is related to 10% of our immune functioning and our gene functioning. And so without optimal levels of vitamin D, your immune system is going to be compromised. And so for me, that was the most important thing to do. That was the easiest thing, was get sunlight and optimize my vitamin D levels. I started to also really look into my gut, and I started taking probiotics. I also started taking colostrum, and these are just simple things that I felt that would really affect me in a profound way. That was going to help my immune system fight whatever was happening in my body at the time.
Excellent. And talked about a lot of topics, and there's not enough time to delve into each one of those. But something that's important for the listener to know is it's not just like a low vitamin D that would cause this diagnosis. It's not just glyphosate that would cause this. It's a combination of all these things that are put together that would, result in sort of just generalized inflammation, leading to these types of diagnoses. So what Dr. Nagula is talking about is eliminating these in a stepwise way, so that you are creating an environment of health in your body, so that you can cure yourself, or potentially help in the process of curing yourself from disease. So that's very important. And I just one reference I want to give folks is the Environmental Working Group. You can Google that, and that's a great way to look at the different products that you're using and decrease your toxic burden, because they have a list of all the products and like alternatives that are less toxic for you. So that's a really good resource for those.
Also, don't forget about the resource for your the Dirty Dozen in terms of foods and your
Yes.
Clean 13. They also have that list and they update that every year.
Absolutely. Excellent. Okay, so basically you made all these changes, and you ended up having to take chemotherapy, and that's you know look, you do the best you can, and sometimes they don't work, and you have to use the traditional approach, or the conventional approach rather, and that's fine. That's what that you make those decisions. So what happened after that?
So after that, I had to really go through chemo, and the regimen consisted of a day and a half of chemotherapy, infusion therapy for a month for 6 months. And the first day was an 8-hour therapy what was a chemo session, and the next day was immunotherapy for 4 to 6 hours. So the combination was essentially necessary to kill the cancer cells essentially, and then any remnants of the cancer in my immune system was going to be taken care of as well. So it was really a 1-2 punch. It was a traditional chemotherapy regimen of bendamustine and an immunotherapy called Rituxan. And these were things that were really, and I had also checked with different physicians whom I consulted with, who all thought that particular line of therapy was the best, even though it hadn't been used it had been used for over a decade, but they did not have long-term studies. Long-term studies were just coming out with the combination of the two, and it looked promising for many of the physicians who had looked at the research. So I was confident this was going to help, but I just did not know how this was going to help what kind of an impact it was going to have on my body. Unfortunately, at that time, I didn't know much about integrative medicine and functional medicine. I just did some research just based on diet and supplementation that I thought was going to help my immune system from a generalized perspective. It was at the end of my 4th or 5th month of chemo is when I discovered integrative medicine as a field, and then I applied to Dr. Andy Weil's program. And I fortunately got in, which is what I decided to do after I got into remission. But during this whole time that I was going through chemo, it was really a fight of my ego. My ego was just could not go through this process. I ended up getting into my wife at the time and I were having issues, and it unfortunately ended up where we separated while I was going chemo, and so I was really alone. And we'll probably talk into this a little bit later, but I realized later that loneliness, which is what I had I'd probably gone through that process when I was going through chemo, but loneliness doesn't necessarily mean being alone. It's having the ability to be able to sync with another person, to have a bond with an individual, have community. And loneliness, what I had discovered during my research, is as much of a risk factor for mortality when compared to smoking a pack of cigarettes a day or having a diagnosis of diabetes.
Yeah.
So that's really huge.
Yeah, 100% absolutely true. In fact, there's a great TEDx talk of this Harvard researcher that followed two cohorts of individuals, a Harvard student group and then another group from the inner city. And they followed them over time and looked at various risk factors and disease, and they found, just as you mentioned, that relationships and close relationships were the best at preventing long-term disease and consequences of that. So that's so important. And just as you mentioned, you could have friends and people around you, but still have that feeling of loneliness inside. I mean, how did you deal with that?
The time I didn't know. I actually did everything on my own. I shut everyone out of my life, friends, family. I did everything on my own. I figured this is what I had to do in order to survive. And what was happening is that I had to have anger as a source of fuel to get me through the day, because I would not let myself go into this, oh, woe is me type of mentality, go into this depressed affect. I had, and so, as anger and depression are on the same spectrum, just on opposite ends. It's the same underlying emotion, and that's depression and sadness, which I would not let myself feel. So, this is how I got through those months of chemotherapy, and which leads me to the first page of my book, which I write. You know, the worst day of my life was not the day that I got the diagnosis, but the worst day of my life was when I was told I no longer had cancer, because that was my identity. And once I lost my identity of cancer, and I had nothing, I had no identity, because I had lost my identity as a husband, as a physician, because I no longer was working. And then the only identity I had was a cancer patient. And once I lost that, I literally was at rock bottom.
Oh, wow. Wow, that's powerful. I mean, you think the complete opposite. You think that would be like the happiest moment. But so what happened at that point? Can you elaborate on that? Like how'd you deal with that loss of identity?
Right. So at the time, I didn't, again, this is all looking back on what I was going through. And for me, it took me about a few months to regain some composure. And as I mentioned in my book, it was really a rekindling of an old relationship with my trainer that I happened to see in the parking lot of a grocery store, and he asked me how I was doing, and I said I was doing better. I was just trying to regain some physical function. I'd lost a lot of weight. I just muscle mass, and I was just very deconditioned. And so he asked if I was ready to start working out again. I said, heck yeah. And so that was when we started to really. It was a start to transformation of myself in a more of a mental and physical mindset, because number one, I started to like hang out with an individual that I so badly needed to do. I needed camaraderie. I needed a bond from a friend. And then my body just needed exercise. And so I needed to get back into the shape that I was in, because I wanted to look at myself in the mirror and just like have a sense of respect for what I had gone through. And I also wanted to take care of myself, because I wanted to stay in remission and not have a relapse.
Okay. So what you said reminds me of a quote, and I'm not getting this quote exactly right, but it's something that Tony Robbins says very often. He says, the most powerful force in the human psyche is staying true to your identity and how you define yourself. Because just as you mentioned, if you define yourself as a father, a physician, or a cancer patient, or whatever it may be, your entire focus is there. And when you lose your identity, and that's how you define yourself, you lose yourself in that process. So that's why it's so important to identify yourself in healthy ways, to identify yourself as someone that's powerful, something that encourages you to move forward in a positive way and a positive light. So you mentioned for yourself, the trainer was that person to kind of introduce you to that. How did that all unfold?
So it was just, as I mentioned, it was just a meeting. It was just a happened to be something that an individual whom I ran into at the grocery store parking lot, and we just
Or how did
started
that
working
unfold
out again.
how did that unfold your identity? I mean, how did you
So
develop?
it was right. The identity that ensued after that was more, again, I was like, I had to become empowered. At the whole time I was in a disempowered state, and so it was like this was the first opportunity where I could have a sense of empowerment. And that was important for me, because I had lost my identity to everything. And so taking the first steps and started to like, exercise, and that was a good moment for me, because I was able to take back some of my life, the life that I had lost. I was able to take back a bit.
Okay. And then did you transform your identity into someone like maybe a cancer survivor or a
So
physician? How did that?
yeah, then at that point, it was then of maintaining my identity. It was maintaining myself in remission. So then at that point was I got into that fellowship program, and then it was, for me, it was like, okay, so maybe this whole ordeal with cancer was basically a way of me having to transition from what medicine that I used to practice into more of a functional medicine mindset. And so then it was implementing all these strategies that I was learning through my fellowship to myself to stay into remission. And then that's when the real journey began for my health and wellness.
You also mentioned to me when we spoke before that you spent about a year in the world of psychedelic therapy, and you felt that that helped. Could you elaborate on that further?
Yeah. So to preface that, we have to understand what I was going through at the time when I decided to move to DC, because I was no longer married and I wasn't working in Florida anymore. So I was like, let me just move back home. And then I had my parents nearby. I had some friends that were nearby, and I wanted to establish community, as I knew that that was going to be important for my transformation and for me to stay into remission, is to have that community and have that bond. And then it was also a discovery of mindfulness, and this is through um, uh, learning through my fellowship that mindfulness was essential. And this is something that I did not have a practice of. I had done some meditation for a long time through transcendental meditation, and I did it on and off for years. And unfortunately, I didn't do this during the time that I was suffering from cancer. And so it was me learning what this was to me. Me was more about getting into a learning to be more in a parasympathetic state, because I had lived an entire life of being in fight or flight, which is another huge risk factor for chronic disease, cancer, et cetera, et cetera. And so understanding that was huge, because then I had to seek modalities of regulating my nervous system. So for me, it was, how do I do that? And meditation was not my thing, because I could not sit there and I'd have the monkey mind keep going, going, and going. And then I would be really hard on myself, saying, you stupid, you're not able to do this simple thing. And, it was that I was learning that that was not the best thing for me. Not only that, but then having that mindset of being hard on myself. That was very important, because I'd always been hard on myself growing up, and learning that that was a contributory factor of me having health issues, because I was so hard on myself. And it was a combination of all those things during my fellowship that really allowed me to learn more about mindfulness and being gentle on myself. And that ultimately led to my first experience with psychedelic medicine. And during this time when I moved to DC, I still wasn't in community to the degree that I wanted to be. I joined a networking group, and this networking group was all about self improvement. It was also about entrepreneurship, but not always about making money. It was more about connection and just bettering yourself as a human being and being of service to others. And so this was a huge thing that I wanted to partake. I wanted to be also service to others. And I had this person who was the head of this of group, entrepreneur group, had asked me if I wanted to join this ceremonial group healing using psychedelics. I didn't know about anything of this at the time. Psychedelics was not on my radar. I said no twice, and then the third time I said yes, and I was more obligatory than just because I wanted to improve myself. And so it was this experience that really shaped and my well-being, my spirituality, and it shaped how I practice medicine and how I view of health and wellness to this day. And I write about this in my book about how it really shaped and impacted the person that I have become.
That's amazing. That's so powerful. And there's more and more data coming out that demonstrates the power of psychedelic therapy in the right situation. I mean, there's, I can't remember the name of this um, documentary I was watching on Netflix. You may know, but they were talking about using psychedelic therapy in hospice patients, and how one treatment of psilocybin, in fact, allowed hospice patients, to just feel comfortable with the idea of death. Um, and it was very powerful. So there's there's so many different treatment situations which this could be certainly beneficial, as you've experienced yourself. And in fact, I'd love to have you on again to talk about psychedelic therapy in more detail, in the future.
Yeah, I'd love to. It's a whole different topic, and we just basically broached the subject. But the study that you were talking about, it's a Johns Hopkins study, and it's a very well-known study in the field of psychedelics. How people who had cancer um, were able to have this experience of psilocybin and had shared to everyone that it was the most enlightening experience of their lives, and it allowed them to surrender to death and be peace and have and become and be at peace with it. And it was very powerful for all these individuals who participated in the study.
Wonderful. Well, thank you so much, Diva. It was wonderful having you. And I really encourage everyone to check out Diva's book, From Doctor to Patient, Healing Cancer Through Mind, Body, and Spirit. Another reference that I mentioned before is Dr. Keith Block's book on integrative oncology. A lot of what Dr. Nagula mentioned in his his journey to healing and health is explained in this book, and it's explained in detail with references. So those of you that are interested in having those references and understanding everything in a lot of depth can check out this book. I'm sure there are many others. That's one I'm familiar with. Diva, any other references you can recommend to folks?
That's a good one that you mentioned. Any books? So I would check out some other topics like on vitamin D and any books about functional integrative medicine. So Dr. Andy Weil has a whole lot of books about just how to live life from a integrative lifestyle.
Excellent. And then one last one is Valter Longo's book on the fasting mimicking diet. And there's some data out there that fasting during these periods of chemotherapy even can have a positive effect. Another book to check out. So thank you again, Diva. I'm excited to have you again on the show. I'm sure our listeners got a ton out of your experience, and I really appreciate you being vulnerable and sharing all this with us. It was very enlightening.
Thank you, Ravi. It was my pleasure to be on your show today.
Thank you.
I hope you enjoyed this podcast. And if you did, please make sure to hit the subscribe and the like button and leave a comment about what you'd like to see on our future episodes. Just a reminder that this podcast is for educational purposes only. It does not substitute for professional care, nor does it constitute medical or other professional advice or services. If you're looking for medical care, please seek a qualified doctor or medical professional. For more information, or if you'd like to check out our programs, please visit our website, peakwellnesshealth.com. That's peakwellnesshealth.com.